Hi, welcome to Healthy Kingston. My name is Janet Wade, and I'm excited about presenting some very interesting and informative guests for you today. We're going to be hearing from Bob Kostka, who's a longtime member of the Water Commission here in Kingston, and he's going to be speaking to the issue of manganese in the water and how the Water Commission proposes to resolve the situation. Next, we'll be hearing from a very interesting woman who's the archivist at the Kingston Library. Her name is Susan Aprill. And when she heard about our health initiative here in Kingston, she went through the archives and was able to find a number of very interesting artifacts, health artifacts belonging to physicians and other people who've lived in the town for quite a long time. So we thought it would be interesting for you to see those type of things. And then lastly, we have an exciting new teen center at the Kingston Library that we want everyone to know about. It offers a lot of 21st century ideas for teens in town to do something with by themselves or with peers in a very unstructured environment that they'll enjoy. I'd like to introduce our next guest, Mr. Bob Kostka, who's a longtime Kingston resident and has been on the board of the Water Commission for quite a few years now, and comes with a tremendous amount of experience and background to speak to the issue of manganese in the town. So with that, Bob, can you tell us a little bit about manganese? What exactly is it?
Manganese gets into the groundwater from natural deposits, and it's roughly equivalent to iron that you get in water sometimes. And when our wells were put in, when you do a well, you do water sampling, and there's a lot of procedures that you have to follow to put in a well. Every one of the wells that we did at the time that we put them in had no traces of manganese in them. This manganese problem is a relatively recent phenomenon, maybe within the last 10 years. And it's occurred all over the South Shore, it's not just in Kingston. And we recognized it some years ago when we were doing routine testing at the Charcoal Pond well site, and we noticed there was some trace elements of manganese. And then the next time there were larger amounts of manganese, and our engineer suggested that we keep an eye on it. And each time we tested, the level of manganese was going up. The state pretty much sets a standard of 0.05 parts per million, where it becomes a visual issue. It's a cloud. The water is cloudy. It's somewhat gray. It leaves deposits and stains on things. So it's more how you look at it as opposed to whether it's a health issue. They have set 0.3 per 1,000 as a place where you need to start seriously thinking about treating the water, because now we're talking about potential risks of health hazards. Right. We have never tested the water in Kingston above 2.1.
Oh, that's good to know.
But we're pretty sure that if we do nothing and wait, sooner or later we're going to hit the point where the state is going to require us to treat the water. I joined the Board of Water Commissioners that's always been very proactive. I won't take much of the credit for all of this. I just tried not to screw it up. And what we've done historically is we treat problems before they become big problems. When the Charcoal Pond well site was showing levels of manganese increasing, we went to the people in the town. They agreed to fund a treatment plant. We put in the treatment plant, and the people that are getting water from that part of town have no issues with manganese anymore. So the high pressure zone, I happen to live in the high pressure zone, and I was getting some manganese, nothing of any extraordinary amount, but I was getting it the first time. We've always, about the same time we saw it at Charcoal Pond, we saw trace elements in some of our other wells. So we know it's not just isolated to the area where Charcoal Pond is, but it's pretty much spread out all over. We kind of knew that because we know from Duxbury and Plymouth and Pembroke that they're having similar issues, and they're building treatment plants to treat it too. As we started hitting levels of 0.2, we decided that we need, and people were bringing in their water, and we have a lot of sympathy for people that are dealing with it, because it's kind of a very ironic thing. Somebody will have gray water and they'll complain to next door neighbor the water is fine. Really? There's a variety of reasons for it. Some of it has to do with the dips that occur in when water mains get laid. It also has something to do with where your water comes from that comes into your house, where it comes off of the pipe. Right. But the bottom line is, there are people that are suffering, and we understand that, we appreciate it, and even if it's just because it looks bad and it stains their clothes and stuff like that, we figure it's something we've got to take care of.
Sure.
So we're going to the town in the May annual town meeting to ask them to approve funding for a treatment plant. It will not affect the tax base because we're an enterprise account funded operation, which means all of the money that we spend comes from ratepayers. There will probably be an increase in rates. That goes to be expected when you're building an expensive treatment plant.
Right.
But even when this is done, we'll still be somewhere in the middle in the state on water rates. Be somewhere right in the middle. It might be slightly above average because of the new treatment plant, and then within a few years we'll be at average and then starting to drift below average as other towns are doing the same thing that we're doing.
Right. Now, the water treatment plant that's existing is the one that's right off Bishop's Highway.
Yep.
And where are you anticipating wanting to put the other one?
If you drive the Mall Road, you'll notice that on the left-hand side there's a gate, and that goes, you take that road back there, and that's where we have two wells. Okay. We have the Grassy Hole well, and we have the 186 well. Okay. The last well that we put in was the 186 well. That was from land that was donated by the mall when they built the mall. That was part of that big deal to get the mall put in there. Mm-hmm. We deliberately designed it that way so that when we put a treatment plant, we can put it between the two, and it'll treat the water from both of those plants. Okay. And another thing I think people should be aware of too is that we are extremely conscious of costs. And when we built the treatment plant at Trackle Pond, we sized it big enough so that we could bring in another vessel and treat additional water if and when we build a new well, because a new well has to be in that part of town. Right. We're in the process of doing exploration for well sites. We think we found a very promising place, and what we'll simply do is pump the water from that well into the treatment plant at Trackle Pond. We'll expand the Trackle Pond plant with another vessel, but the building has already been sized for it. Okay. So we took all that into consideration at the time we built that plant. Okay, that was a very intelligent move. Thank you. Let me ask you, when you test the water, do you test it just at the plant? Do you test it at the faucet at home? Okay, we always test it at the plant because that's what's required by DEP, but we also have places around town where we'll take water samples. Okay. We want to see, for example, if people are getting iron in places that we don't expect it, or sometimes if someone has a lead service, if we're testing the water in their house, we'll detect lead. If we detect lead, it's probably coming from someone who has a lead service. Okay. So we do a variety of places around town to test, to make comparisons between that and what we see at the plant. Okay. I thought it was interesting, you were telling me earlier that it's more of an issue during the summer than it is in the winter. The manganese issue is the pumps are pumping in the water and pumps it from the well into the system. And when the water sits in the pipes, over time, the manganese will settle to the bottom of the pipe. So if people are using water normally, they're using water, and most people will notice no evidence of manganese at all. Mm-hmm. If you have an event, for example, a few weeks ago there was a pipe that burst at Lowe's, part of the fire suppressing system, and there's suddenly a surge of water. When there's a surge of water, it stirs up the manganese from the bottom of the pipe. So whenever we have a surge of water from a water main break, or someone having like a fire suppression system break, or if there's a fire and we have to pump a lot of water for a fire, we always know the next day we're going to get a bunch of calls. People are going to call because that's going to get stirred up, it's going to be in the water, and they're going to be concerned because they haven't seen it before. Right. Typically what we tell people to do is if you run your cold water for a period of time, most of it will go away. Really? Yeah. Well, that's good to know. Secondly, if you are seeing manganese on a fairly regular basis, you're one of those unfortunate people that happens to be in a place where the way the water gets into your house happens to, unfortunately, take manganese with it. Right. Our recommendation would be to put in a water filter. You can put in a whole line water filter in your basement. Okay. Or if you're talking about water for your pets or for people to make coffee, you could put it right in your kitchen, too. It'll take it up. Is that an expensive investment? Or? It depends on how much manganese you're getting. For people that have a real serious problem with manganese, the filters get expensive. Okay. They've asked us to pay for them, and we can't really, because if we started paying for water filters, everybody would want a water filter, and they want us to pay for the replacements, and your water rates would go right through the ceiling. So the vast majority of people don't need them. Those that need them, once the treatment plant is up and running, which we're hoping we get the approval in May, we're looking at somewhere around 2 years for the design and engineering and the actual construction of the plant and so on and so forth, looking at about 2 years. At that point, you'll see some minor traces of elements of manganese that is still in the pipes. We've flushed the pipes every year, and when we flush the pipes, we've tried to flush out most of the manganese, but manganese is pretty, it's almost like a teenager. It really hangs right in there onto the pipes. So over time, most of that will go away. Periodically, we will pump the bottom of the storage tanks that we have, and occasionally there's a foot or 2 feet of manganese at the bottom of that we'll pump out, so that doesn't get stirred up. And over time, 5, 6, 10 years from now, it will just be, what are those plants? That's what treats manganese. What's manganese?
Right. Well, terrific. So in the meantime, what do you suggest as a water commissioner that
in the meantime, if you're not seeing any problems, you don't have a problem. The state would have come down on us already if we were pumping water that had manganese at the level that triggers their compliance, which would be to build the treatment plant. We haven't reached that yet. So our best guess is the vast majority of the people don't see it, don't even know it's a problem. They hear people complain about it, and they wonder what they're complaining about. And then the people that are getting it are wondering how come no one else is complaining, because it's them, and it is bad. The people that brought water into our meetings, we've seen it. It is bad. It looks disgusting. And yeah, I can wonder how you'd want to drink that or give it to your dog and so on, sure, which is why we want to build a treatment plant. The key here, from our perspective, is the last time we built a treatment plant, everybody in the city of town, in the town of Kingston, voted to do it, even though it was only affecting a small number of people, but everybody thought it was a good idea. We're hoping those people who had their water cleaned will vote yes for the people that voted for them before.
Exactly.
That's what a democracy is about. And we're hoping that people do the right thing and support their neighbors who are having trouble with the manganese.
Okay. Thank you so much for the work you do for the community, and thank you so much for being here today. Very informative. As I told you, I never knew manganese could be so interesting. Thank you. I'd like to introduce you to our next guest. Her name is Susan Aprill. Susan is an archivist at the Kingston Public Library and has been so for the last 11 years. And Susan, welcome. It's nice to have you.
It's nice to be here.
What exactly does an archivist do?
Well, I'm an archivist, but sometimes I call it a local history librarian. And I'm responsible for the local history room, which means I take care of all of the historical collections at the Kingston Public Library. And we have an enormous variety of things. We have thousands of photographs and other kinds of images. We have over 100 collections of manuscripts, personal papers, and records relating to the town and other organizations.
Really?
Really. We have hundreds of maps and plans. We have books and magazines and newspapers. We have lots of artifacts, like the ones that I'm going to show you, that I have here today. My job really has 2 parts. One is physical inventory, and one is what we call intellectual control. Physical inventory is just knowing where things are.
Right.
But the intellectual control part is knowing what's in a collection, how it relates to other collections or other items, either in the local history room or around the world. And I also have to know what kind of stories these records can tell. So the second part of my job is matching historical materials to specific uses. I get about 150 requests every year by email, by phone, sometimes even by regular letter, from people who want to know about their Kingston ancestors or their houses, or they want to see a town report or a yearbook, or they want a photograph of a person or an event. Most people are local, either from Kingston or Massachusetts, but I get questions from across the country and even international. But most of the people who call from Canada are looking for Kingston, Ontario.
Oh, for heaven's sake.
It's a funny one.
Oh, wow.
And I do a lot of outreach activities. I've been to the high school to talk to a journalism class. I do regular exhibits at the library and special exhibits for the farmers market or the waterfront festival. I even go on TV.
Right. Well, and we're thrilled to have you here. And I did want to ask you, I was so excited when I saw the display of items that you put together at the library. And how is it that you took the initiative to do that? Why did you want to do it? Tell us more about it.
Well, I'm always poking around just to see what I can find and what might make a good display. It needs to have good visuals. And Stephanie Legg, our children's librarian, told me about the Board of Health initiative that she was going to be working with, and they have some great things in the children's room. And I thought, I have enough stuff to do a medical exhibit. So I thought that would be a perfect time.
Well, terrific, and it was wonderful timing, particularly where we're just getting this program off the ground and getting people more sensitive about their health in Kingston. So can you tell us what's included in the display?
I can. We have a stethoscope and a blood pressure cuff, and I don't know how to pronounce the real name of that.
Sphinctometer.
That's why I didn't say it. These are from a collection of a doctor in Kingston who was named William C. Gould. He came to Kingston in 1937, went away to serve in the war, came back in 1946 and set up a practice at his family home on Main Street.
Oh, for heaven's sake.
He was an orthopedic surgeon, but he served as a regular physician to many people in Kingston. He was on the staff at Jordan Hospital for about 45 years, and he was the Plymouth County Medical Examiner for 25. His collection was donated by his daughter, who still lives in Kingston, and she brought us 2 photographs of him.
Oh.
Especially like this one. He's with his grandson, Matt, and his dog, Sweet Willie.
His dog.
And from Tourist Pharmacy and its predecessors, we have a pill display box, a Henry Breach medicine bottle, a bottle of Job's Tears.
For heaven's sake.
We have O.B. Cole's prescription book and Leon Tourist's first ledger. So
wow.
the story of Kingston's pharmacy is pretty amazing. Starting in 1877, Henry Breach was a pharmacist who worked in someone else's pharmacy on Summer Street. He moved a little ways down Summer Street. In 1898, he sold the pharmacy to Walter Loring, who sold it to Frank Jordan in 1913 when it was known as Jordan's Kingston Pharmacy.
Huh.
In 1937, Leon Tura bought it. Most people know this as Tura's. This is
So it has stayed on that original spot the whole time?
It's moved around a little bit, but it's been on Summer Street for almost 140 years.
Uh-huh.
I have a couple of other things here from the Loring family collection. I have some bills from when they saw Dr. Gould, and I have a baby bracelet for one of the Lorings.
Oh, for heaven's sake.
I also have a page from a scrapbook with a prescription from Dr. Loring and a pill taped to it. This is from 1946.
In fact, it's interesting. I still do that in nursing, putting the pill on the card and telling people how to use it.
I had no idea that was a thing.
Yeah, that's really neat. That's really neat. What do you think is the most interesting of all of these? Have any of them impressed you in particular?
I have to say, the Job's Tears I find fascinating. When I was packing up the Tura pharmacy records for the library collections, Paul Tura kind of threw this in. I had no idea what it was, but it's used as a folk medicine, and it's also used in necklaces and rosaries as beads.
For heaven's sake. It grows wild? What is it?
It's a grass. It grows. It's used in Asian medicine and sometimes still in homeopathic medicines today.
Huh.
And then probably my favorite thing is the baby whose bracelet this was is all grown up, and she comes to the library regularly.
Oh, really? She's aware you have it?
She gave it to us. So it's a great thing.
Well, I could talk to you for hours, but the one last thing I wanted to ask you is, particularly being an archivist, why is it important to look at the past?
Well, I think the big lesson is that everyone has a story, and every place has a story as well. But people move around so much now that they're not always tied to a place. But here in Kingston, they are. There are really strong links between the people and their neighborhoods and their businesses and other groups, as well as the government and Kingston as a place. And one of the really specific lessons I've learned is that there's a very close connection between the people I meet and the collections that I have. So I mentioned that Dr. Gould's daughter had given some of his tools to us for a historical collection. When I first put the exhibit together, I realized we didn't have any pictures of him. So I looked up her name and phone number, and I was getting ready to call her when she just turned up at the library one day with a photograph of her house that her neighbor had given her. She wanted to find out more about it. And the picture had come from the local history room. And so we kind of went in a full circle, and I got to show her the exhibit with her father's stuff in it.
Oh,
it was really great.
That's tremendous.
And to me, that's what local history is really about.
Really all about, right, personalizing it.
It
Thank
is.
you so much for your time and for
thank
what
you.
you do for the residents of Kingston. We're fortunate to have you. The
I have a
library.
great time doing it. Thank you so
Okay.
much.
Take care. Now we're going to hear about an exciting new program in Kingston at the library, and it's for teens. And we're fortunate to have Mike Slawson here, who is a library tech, and is going to be telling us about how he is one of the people who created the room, how they went about designing it. But first off, I'd like to find out from you, why did you want to do it? How did the idea come about?
Well, we're always looking to improve the library, and I think we identified the teen population in Kingston as the population that was most underserved at the library. They had a very small area, and honestly not a lot to do, and we wanted to change that. So when we were looking for ways to improve the library, we said let's go for it. Let's build a spot for teens and give them a place of their own.
Who was in on the creation of the room?
It was the room was a collaboration between a number of different people and a number of different groups. Of course, you had the town of Kingston, you had the library trustees, the Friends of the Library. We had a number of different donors in the community that really stepped up and helped us out. And of course, you had all the library staff who all worked on it in their own way.
And I guess I would think what most people, and certainly I am interested in, is how did you decide to put in there what you have in there, which is fantastic, and I want to hear all about it.
So what we really wanted to do with the teen room was take the things that everybody knows that make libraries great, the classic library things like reading and browsing the collection and doing research. We wanted to make sure those were there, but then we wanted to add something extra as well. We wanted to add we wanted to give a glimpse into what the future of libraries will be like, because libraries are changing, and I think you can see that in the teen room, and it's a positive change. So we looked at getting iPads, and we got a new iMac computer, and we have a virtual reality system that teens can use. And like I said, in addition to those, the classic library skills that people can learn at the library, they can also learn new skills, 21st century skills, how to create digital art, how to edit photos, how to make music or sample a tune. So we're really excited that not only do we have the great classic library skills, but we're also focusing on skills for the 21st century.
Have you had teens who've been in on planning anything that's gone on in there?
Yes, so we work closely with the schools. We also work closely with the teens that were already coming to the library, and we reached out to them and asked, what do you want in the room? How do you want it to look? What can we put in there that you will use? And so far, it's been very successful.
Yeah, tell me about the use. How's it being utilized?
We opened officially on December 17th last year, and since then we've had close to 350 visits.
Wow.
Which is really good. And I think what makes me the most happy about it is that everything in the room is getting used. It's, people are drawing, people are making music, people are reading and doing homework. So it's been a great success so far.
Terrific. Are there any groups that meet there? Like, can teens as a group get together and do something, work on something?
So we have a couple different book groups that meet there. We also have a teen committee that meets there as well. So there's all sorts of things going on in the teen room. And
tell me about the virtual program you said on, was it Wednesday nights?
Yeah, so every Wednesday, we just started a few weeks ago, every Wednesday at 5, we take out, and this is in the teen room, we take out our virtual reality set, and we let people come in and try it out. And they can, they can go to space, or they can drive a flying car, or they can explore an ancient tomb, or they can play a fun game.
That's terrific.
So the teen space has, I think, really shown that, libraries aren't book warehouses. They're not just places you go and be quiet and sit and read. They can also be an active, vibrant area where people go to engage with other people and to have fun and to learn and to enjoy themselves.
That's great. Well, it's a tremendous asset to the town and for the young people in the town to have a place to go with their peers or by themselves. Thank you so much for being here. Thank you for what you do for the citizens of Kingston, and I know you said you have been one for a long time.
Yes, yep, almost 38
born and bred,
years.
yes. So thank you for being here, Mike.
Thank you.
Enjoyed it.